Associate Professor in Mental Health Nursing. Many of us experience various situations wherein it will be difficult for us to deal with, or it will be very stressful for some individuals to overcome it. Yes, there are some individuals who will be able to overcome these stresses. They use their coping mechanisms, they come out of it, they feel very joyful. But there are individuals who are not able to manage these stresses, the coping mechanism fails. Okay, they may seek the help from the other individuals at times, right? When it becomes very severe, okay, so it is going to have a disturbance in their personality, in their daily life, okay, in their activities. Yeah, we can say that it is going to interfere with their usual functionings, which may require them to visit a therapist, right? So they may seek the help of a psychotherapist to overcome those situations which they feel very difficult. So today I'm going to talk about a topic which is called as psychotherapy. What is this psychotherapy? Psychotherapy is a general term which is used for the process of treating the mental or the emotional disorders in the client who is suffering with these conditions, wherein the client will be talking about these issues with the healthcare provider, or we can say a specialized mental health professional. So, what happens during the psychotherapy? So, during the psychotherapy, the client will learn about himself, right? He's going to learn about his own thoughts, his feelings, his moods, and also his behavior. So, he is giving his own time to learn about himself, okay? Self learning, or we can say self awareness, or the insight can be learned through the psychotherapy. So, using these insights or the knowledge which the client will gain during the psychotherapy, the client will be able to cope up with the various stressors. He'll be learning the new coping skills, and he'll be able to solve his own problem and manage the various stressors. So, that is the overall, function of a psychotherapy, which is very, very important and which is very much, used by the clients. For how long should a psychotherapy go on, right? So it depends on the individual, or it depends on the client. So if the client is able to make use of these therapy sessions in a thoughtful way, is going to gain the insight, who is able to solve his own issues or use the coping mechanisms by his own self within just few weeks or few months, that he can stop these sessions. But if the mental disorders or emotional disorders are very severe, then he may require an additional time, can go up to a year or so with the therapy sessions. Let us see the definition of the psychotherapy. Psychotherapy is a general term for the process of treating the mental and emotional disorders in clients by talking about the client's conditions and issues with the mental health provider. So, that is a definition of the psychotherapy. Moving on to the indications of psychotherapy, we've got a list of the emotional or behavioral disorders or mental disorders wherein psychotherapy is used. So, when I say a treatment in case of a psychiatric condition, right, we use the psychopharmacological agents, we use the psychotherapies, we use the other physical therapies like ECT. So combination of these treatment that we use, so that the client will be able to overcome all his issues, right? So there are conditions wherein the client may require both the help of a psychotherapy as well as the psychopharmacological agents for overcoming the mental disorder. There are conditions wherein only therapy sessions are enough for the client to overcome his minimal disorders or the stressful situation. So it depends on the individual whether he requires a combination of treatment. So when I say the indications of psychotherapy, many of these conditions, okay, require psychotherapy, and the duration of psychotherapy depends on the client's problem. or the level of the problem. So let us see the indications. Number one, we have got the grief. So in conditions wherein the client is not able to cope up with the grief process, so there is a death in the family or there is a loss in the person's life, so he will undergo a normal process called as a grief reaction. So if he is not able to overcome the grief, then he may end up with the depression, right? So in those conditions, they may opt for a psychotherapy. The next indication is in case of anger, in case of abuse, in various kinds of abuse. So we have got the drug abuses, substance abuses, or we have got the sexual abuses, the childhood abuse, elderly abuse, like that. Various forms of abuses, these psychotherapy is used. The next indication is in some conditions, like medical conditions. Say, for example, there is a client who is newly diagnosed with diabetes mellitus. You will understand it's very simple, right? But it may be a very important thing to the client. So imagine a person being diagnosed as a diabetic. Okay, is newly diagnosed as a diabetic. Lifelong he has to be on treatment. Lifelong he has to have restrictions and he has to follow certain things, right? So it is going to cause some kind of anxiety or fear or anger in the client, which may require help from a psychotherapist, right? So not only the diabetes mellitus, any other conditions, medical related disorders, it can be a cancer, it can be AIDS, or any kind of a medical condition, say endocrine related disorder. So all these may require the help from a therapist to overcome this stress or the anxiety and fear. So that is another indication. The next indication is the relationship problem. So you can see nowadays a lot of relationship problem, family conflicts. There's a problem with the husband and wife, the problem with the children, okay, not concentrating on children. So child can end up with a problem, or the spouse, the couples can end up with a problem, right? So relationship related problems which may require the help from a counselor or from a therapist. The next one is the sleep disorders. So sleep disorders also, okay, there may be various reasons why a person is having a problem with the sleep, right? It can be related to phobias, can be related to the insomnias, the actual problem with the circadian rhythm. Okay, so can be many reasons. So that is also one of the indications, sleep disorders. The next indication is the work problem. So what is this work problem? And people work in different settings, in different situations. There may be a lot of stressors. What is a stressful thing for me may not be a stressful thing for another person, right? So how we deals with those stressors in the workplace, how we deals with the relationship in the workplace. Okay, it can be a difficult thing for him, right? So any problem related to the occupation or work related problem can require help from a therapist. The next indication is the sexual disorder. So another sexual disorder. So because of a lot of pressure, a lot of stress, there may be difficult with the relationship in terms of intimacy, right? So problems with the sex, right, can be. So because of this thing, okay, problems with the sexual functioning can result in infertility, or we can say can result in abortions, right? So like that, there are so many problems which can arise because of dysfunction sexual relationship, which may require the help from the therapist. The next indication is in case of depression. Okay, obviously a person who is depressed may not talk, okay, may not be cooperative. He may require a lot of therapy sessions to just even to share or ventilate his problems. So he may require help from a therapist. We've got the bipolar disorders, got the anxiety disorders, various kinds of phobias which may require the help from a psychotherapist. The next indication is the eating disorders. So again, eating disorders you take, we have got anorexia nervosa, bulimia nervosa, fear of gaining weight. So it's going to cause the anxiety, going to cause the depression, he may require the counseling sessions. Then we have got the substance use disorder. So we have got various substances of abuse, can be alcohol abuse, various drugs, opioids, and cannabis. We got cocaine, marijuana, heroin, like that. So many drugs we have got, and you've seen recently also how these drugs are easily available in the to the public, how they are misusing these drugs, they are abusing these drugs. So because of this, there may be a lot of chances that the young generation or the young adolescents are getting involved into various things. Okay, so they are getting arrested, right? So these people may require the help, not only when he quits the particular substance, when he comes out of it. Okay, it can be resulting in withdrawal symptoms, it can be resulting in various mental disruptions, so which requires a counseling session, right? The next indication is a personality disorder. So personality disorder, again, you've got various types of personality wherein the psychotherapy is used. So this is about the indications of the psychotherapy. You see number of indications, almost all, many of these psychiatric disorders requires a help from a therapist. Moving on to the types of the therapy. Okay, what are the various types of the therapies which are available in the psychotherapy? So we have got various therapists who are trained in the particular set of therapies. Only those therapists can give the or deliver the psychotherapy to the client. Okay, based on what basis the client is suitable for this particular therapy. So initially they are going to do an assessment, they're going to find out what are the issues of the client, what are the problems of the client, okay, the cause, what kind of therapy is going to suit for the client's problem, so that they're going to determine. So based on the problems or issues of the client, okay, they're going to determine the type of the therapy along with and with the preference, okay, of the client. So based on the preferences of the client, they're going to decide on the type of the therapy which is best suited for the client, and they will opt for the psychotherapy. We've got various types of psychotherapy which are commonly used. Let us see each of it in detail. Okay, the first type of the psychotherapy is the art therapy. Otherwise, it is called as creative art therapy. As the name says, art or creative, you can imagine, it is something of colors, or you can say something of art, right? So creativity. So what is the creative art therapy? It uses the creative techniques or the creative process wherein the client will use to express his thoughts, his feelings through the process of the art, right? It can be of various art, it can be related to the music, dance, movement, dramas, drawing, painting, poetry writing. So these are all the various forms of arts which the client will use to express his feelings or thoughts. So through this art therapy, the therapist will be able to analyze, do the assessment based on his dance or based on a music or based on the drawing, painting. Okay, the whatever the thought the client had or the feelings the client had is expressed through this art, through this creative therapy, and the therapists are going to assess this and they're going to do the treatment. Okay, so that is the one of the therapy which is called as the art therapy. The next form of the therapy is the behavioral therapy. As the name says, the behavior. Okay, so behavior is something which can be modified at any point of time, which can be learned or unlearned. So here, behavior therapy are used to help the client modify his maladaptive behavior and adapt to a healthy behavior. In this behavior therapy, we have got the list of techniques with the psychotherapist will use, right, to modify the behavior, to change the behavior of the client. So they make use of the rewards, they make use of the positive reinforcement, the desensitization techniques to bring about a change in the behavior. So that is the behavioral therapy. The next type of a therapy is the cognitive therapy. So as the name says cognitive, you're going to see that there are some changes that you're going to bring about in terms of the thoughts, right? So here the client may have a distorted thought, so we are going to help the client to change his distorted thought. So these distorted thoughts are going to cause changes in the behavior. They're going to cause trouble in the client because of the distorted thought. So once these distorted thoughts are changed, the behavior will be changed. The self-defeating behavior or the self-destructive behavior will be changed. So what is the overall goal in the cognitive therapy is to bring about a change in the distorted thought so that his behavior can be modified. So that is what is the cognitive therapy. The next form of the therapy, we have cognitive behavioral therapy. So as the name says, cognitive behavior, both the combination of cognitive therapy as well as the behavior therapy, the therapist will use here, right? So cognitive therapy, you're going to modify the cognition, distorted thought. Behavior therapy, you're going to bring about changes in the behavior of the client. So, in the cognitive behavioral therapy, it is going to help the client to identify these unhealthy thoughts, negative beliefs, and the behavior, and they're going to bring about modifications in these kind of thoughts and behavior, wherein the client will adapt to the healthy, positive ones. So, you're going to replace the cognitions which are negative, cognitions which are distorted, the behaviors which are very negative to a positive, adaptable ones. So that is the cognitive behavioral therapy. The next type of the therapy we have is a dialectical behavioral therapy. What is this dialectical behavioral therapy? It is a form of a cognitive behavioral therapy wherein the primary goal or the objective here is to bring about changes in the behavior of the client. We teach the client the behavioral skills to tolerate various stressors, regulate the various emotions of the client, so the mood of the client, and improve the relationship of the client with the others. So that is what is done in the dialectical behavioral therapy, which is one of the type of the cognitive behavioral therapy. The next type of a therapy is the exposure therapy. So, what is this exposure therapy? It is one of the behavioral therapy techniques which the therapist will use to bring about the change in the behavior. Okay, so say for example, the client is very much anxious about a particular situation, or the client feels very much disturbing in those particular situation. So here in this therapy, the client will be continuously exposed to the particular stimuli or to the particular disturbing event or to a stimuli, wherein the client will be able to cope up with it effectively, right? So that is called as exposure therapy, which is one of the techniques of the behavioral therapy. The next type of a therapy we have is family therapy. So as the name says, family therapy, it is a therapy which is given to the individuals or to the family members. So a family may be having a lot of conflicts, a lot of relationship problems, a lot of communication gaps. So through the family therapy, the individual will gain the insight to various issues or the problems that are there in the family, and they're going to work together to resolve all the conflicts to maintain a good relationship and the communication in the family. So that is what is a family therapy, which is given mainly to a family. The next psychotherapy is the group therapy. So as the name says, group, we have got a group of, say for example, we have got 8 to 10 people who are having the same kind of the problem, the similar problem. They are grouped together in a small group, and they're going to discuss the various issues or the problems that they have, and in the group they're going to give suggestions for each other how to overcome a particular problem by themselves, which is led by a qualified mental health provider or the counselor, right? So under the supervision of a mental health provider or counselor, a group therapy works. Say, for example, Alcohol Anonymous group. So it is a group therapy wherein we have got a group of people who are alcoholics. So all of them are having a problem with the alcoholism. So that group, they're going to discuss their issues, they're going to raise their concern, they're going to help each other, they're going to give them suggestions, work together in a group and try to solve the problem with the guidance of a therapist. So that is called as a group therapy. The next type of a psychotherapy is interpersonal psychotherapy. So what is this interpersonal psychotherapy? As the name says here, the client will have a problem with the other person, right? So interpersonal relationship is not there or is not developed, right? There's a problem with the interpersonal relation. Can be with the family members, or can be the colleagues, can be the friend. Okay, so there is a problem with the interpersonal relationship. So in this particular interpersonal relationship, the client will be taught how to identify these problems, how to overcome the conflicts in the interpersonal relationship, and how to deal or communicate in the interpersonal relationship or with the other person. So that is what is the interpersonal therapy. The next form of the psychotherapy is the marriage counseling. Otherwise, it is called as the couples therapy. So what is this couple therapy? Here, if you take a marriage, there are going to be two people. There are going to be a lot of differences. There may be a conflict. There may be arguments. Yes. So in this couple therapy, the therapist will be working on the couples, and they'll be teaching them how to have an interaction, how to focus on the relationship, how to have a healthy argument, and how to solve the problems in the marriage. So that is what is done in the marriage counseling or the couples therapy. The next type of the psychotherapy is the play therapy. So what is this play therapy? As the name says, play, who usually play? It is the children who play, right? So it is mainly given for the children. So if you take a child or the children, the group of people or the group of children will not be able to express in terms of how the adults express in terms of their words. So there are children who will not be able to express their emotions or their feelings. So in those cases, play is a form of therapy for them, the treatment for them, wherein through the play, wherein we'll be using various kinds of the play therapy techniques, wherein the child will be expressing his feelings, his thoughts, and his emotions. Through that, we will be getting an idea that this is what the problem of the child is and how to deal with these problems, right? So that is what is the play therapy, especially which is used in the developmental disorders, okay, in the children to express their mood or to express their feelings. The next form of the psychotherapy is the psychoanalysis. So it is an in-depth Freudian based therapy, so wherein he uses the techniques like dream analysis, free association. So that is the techniques which are used in the psychoanalysis, wherein the therapist will guide the client to examine their past memories or events or feelings which had happened with the current situation, with the current feelings or the behavior. So with the past as well as the present situation, the client is able to understand his events or feelings and behavior. So that is what is the psychoanalysis. The next type of the psychotherapy is the psychodynamic psychotherapy. It is based on the theory of psychoanalysis again. So here the client will be focusing on the unconscious thoughts and behavior. So you are going to bring about an awareness in the client about his unconscious thoughts and his behavior, and also develop new insights for the new behavior, motivate the client, and also resolve all the conflicts that he had in the unconscious level so that he can lead a happy life. So that is what is psychodynamic psychotherapy, which is based on the theory of psychoanalysis. The next type of a therapy, we have the psychoeducation. So here the psychoeducation is given both to the client as well as to the family. So there will be teachings in terms of the problem solving techniques, the coping abilities of the client will be taught, various treatment options or the strategies which are used for treatment of the client. So all these education will be given in terms of the psychoeducation to both the individual as well as the family. Moving on to the exact thing what happens during the psychotherapy. So when there is a psychotherapy session, what exactly happens? So during the psychotherapy sessions, usually the client as well as the therapist sit facing each other. Okay, they sit in a particular environment in a room which is free from all the noises, free from the external sources. They sit facing each other. So here the client is encouraged to express all his thoughts, his feelings, ventilate his emotions, ventilate his issues of concern. So that is what the encouragement will be given from the therapist point. And also the therapist helps the client to gain more confidence and to feel more comfortable during the psychotherapy session. Sometimes the therapist can give a homework to the client. So in homework in terms of giving a time for the client himself to understand his own self more, to understand, to become more aware about his own problems, or what are the skills that he may require to solve his own problems, the new technique which he would have learned in the therapy sessions, all these things that he can actually work on during this homework time. So this homework is really going to help out the client to gain more insight about his own self, to solve his own problem by his own self, and to feel and think good about himself. So overall, it is going to help him to solve his own problem. That is what is a homework which is given by the therapist at times to help the client himself. Another important thing which may happen during the therapy session is the client may have the emotional outburst. So there may be crying spells, there may be the outlet of anger, a lot of emotions, wherein we have got the therapist to just comfort the client and move on with the various expressions or the feelings which the client will ventilate out. So we have always a therapist who is going to help the client to cope up with these kinds of feelings or the emotions. How long the therapy session is required depends upon the client, the problems of the client, the extent of the problem, ability of the client to overcome or cope up with the issue, right? So based on these things, the therapy sessions may take few weeks or months, or at times it may even take a year or so on, right? So that is the duration of the therapy. Let us see the factors on which the length of the psychotherapy depends. So we have got a list of factors. Number one, we have the type of the disorder or the situation. As I told you, what is the cause? Okay, so what is the situation the client is experiencing? What is the problem the client is experiencing? Based on that, the length of the psychotherapy varies. Second one is how severe the client's symptoms are. So whether the symptoms are very severe, if it is a mild form, moderate form, within few sessions we can see that there is a change in the symptom. But if the symptoms are very severe, okay, so then the therapy sessions may go further. Next is based on how long the client had been suffering from this particular symptom, or he had been dealing with a particular situation, since when he was having this problem. So based on the duration of the symptom also, the therapy session will vary. The next is how quickly the client can make the progress. So what is his coping ability? So what are his abilities to overcome a problem? So if he is able to cope up with the problem very soon, the progression will be very soon, then the therapy session can be ended very soon, right? So based on the client's ability of progress in the therapy session, the length of the psychotherapy may vary. The next thing is the how much stress the client is having. The level of stress also plays an important role in the length of the psychotherapy. The next is how much support group that he is having, how much support he is getting from his family or his friends, his colleagues to overcome his issues or problems. If there are no support from the friends or families, no support group, then it may take a lot of time to overcome his problems. But if there are support, moral support from the family, from the friends, he will be able to overcome his problem very soon. So in that time, the length of the psychotherapy may be lesser. So that was about the factors which are going to affect the length of the psychotherapy. Moving on to the benefits of the psychotherapy, we have got enormous benefits of psychotherapy. The first one is it will help the client to gain better understanding of his own self. Right, he gets more awareness about his own self. He takes time to understand his own self and also about the situation. The second benefit is we are going to help the client to identify his problem and to bring about the changes in his thoughts and his behavior, which is going to have a very impact on his life. Right, so all the negative thoughts or the feelings, the behaviors can be modified when the client is able to identify, when the client is able to make some progress in his change in or modification in his behavior. The next benefit is it's going to explore the various experiences or the relationships. So here the client is going to have an experience in the various kinds of the relationship and all. Like, it's going to be an experience for him to how to learn to maintain that kind of a healthy relationship or the positive relationship with the other people. Psychotherapy helps the client to better cope up with the various situations or the problems and to deal with the new situations also effectively. It will help the client to set realistic goals and also to have priorities in his life. Okay, to what is the objective, what are the goals in his life, so that can be clearly met when he comes for a psychotherapy session. The client overall feels better about himself, the best about himself. So these are the benefits of the psychotherapy. So moving on to getting best out of this psychotherapy, or what is the maximum success that we can achieve out of this psychotherapy. Number one is approach the therapy as a partnership. So who is having a partnership here? The client as well as therapy, they are going to be the partners, right? So they're going to work together to solve the client's issue, and the therapist is there to guide the client to overcome all his problems, is going to give him the confidence, boost his motivation, and is going to help out the client to solve various issues. So here we have both the client as well as the therapist who is going to work as a partnership. If there is no interest from the client's end, or if there is no interest from the therapist, and then the overall therapy cannot be successful. So we can say that the therapy sessions will be effective if both the client as well as the therapist are active and they are actively making the decisions together. So here the client as well as the therapist sit together, make sure that they solve the major problems together, tackle them effectively, and also set the goals and reevaluate the progress of the therapy. So that is one of the important thing which is going to be very effective psychotherapy. Approach the therapy as a partnership. The next one is being open and being honest. Very important thing here. The client has to be very open and very honest to express all his thoughts, feelings, or behaviors, whatever he wanted to express it out. And not only that, he has to be very open to even accept the suggestions or accept the ideas from the therapist to lead a better life. The next thing is, for effective therapy sessions, the client has to do the homework in between the client has to do the homework in between the therapy sessions. So what is this homework between the therapy session? At times the therapist can give some homework to the client. Okay, the homework is nothing but to make the client understand his own self, make the client to solve his own problem or face certain situations or cope up with the issues by his own self. So that is the time which is given to the client to understand and to make his own homework. So whatever that he had learned in the psychotherapy, that is going to use in his personal time to solve his own issues or the situations which come across. All right. So that is the homework which has to be done by the client. The next thing is make sure the client feels comfortable with the therapist. One of the very important thing for a successful psychotherapy is the client should feel very comfortable with the therapist. So if the client is feeling comfortable with the therapist, he is going to share his problem, ventilate his feeling, share his ideas or emotions, which are really going to help him out. The therapist will be able to understand, help the client out. But if the client is very much reluctant, is not maintaining that interpersonal relationship with the client, then the trust may not be developed and there will be overall failure of the therapy session. So very much important thing that there should be a mutual therapeutic relationship between the client as well as the therapist. So these are the certain things which are very much important for a successful or effective psychotherapy. Okay, so this is about the basic thing I have told you in general about the various types of the psychotherapies, the benefits, as well as the duration of the psychotherapy. So, in the future classes, you will be learning about in detail of each of the therapy. Okay, so hope you all have understood the topic. Thank you.